All right. Hey, this is Josh, Dream Body Clinic. I'm here with Shawn, returning patient. And you were here, what was it, about a year ago?
Yeah, about a year ago.
Yeah, so you were here last year. You had, contacted us, came, you were having some different issues. Like, what was going on?
So I was having my brain and body was basically shutting down,
Yeah.
And I was, it caused a lot of anxiety and just, it's not a good feeling.
Yeah. Well, you were telling me you found you had a genetic marker, right?
Yeah.
It's causing some issues.
Yeah.
So you're having all these weird problems and it just kind of came out of nowhere, right?
Pretty much, yeah.
Got it. So you got a hold of us. We looked at some different things. So you came and we did what? We did an IV like we're doing now.
Yeah.
We did, and the big thing was the intrathecal.
Intrathecal, yeah.
So we did that. That's where we go into the spinal cord fluid and we can get the cells, up the spinal cord, fix up damage there, get the central nervous system and get them to the brain. And did we do your knee last time too?
You did, yeah.
Yeah, so I guess just kind of an update. We'd just love to know how you're doing now.
Yeah, a lot better. So
You're back, so that's
I'm
good.
back, yeah. Yeah, the intrathecal was a game changer. It just calmed my nervous system down.
Wow.
And game changer. So all of it.
How soon after the intrathecal did you really like change?
I believe the same day.
Really? Yeah. Okay, cool. They can work fast. I mean, I had some nerve damage years ago. It took about 10 days, but I started dreaming almost right away again after, at least remembering dreams was a big deal for me. So
Yeah, it was the anxiety that I noticed was
really
gone, lighter.
that's crazy. And they're pretty sure it was from this genetic thing, or you said you were dealing with some stress too.
Yeah,
so
some stress and
probably a combo.
yeah. Yeah.
So, you never know with anxiety. So it's we've had patients that lifelong anxiety. Some of them see results, some don't. But looks like we're done. Get the nurse in here to stop that. But anxiety. There have been patients that have done the intrathecal, and it's really just fixed that up and made that difference. So I'm super glad that did that for you. That's
Appreciate
great.
it.
And then with the IV portion, obviously it goes through your whole system. A lot of people find like their immune system works a lot better. Did you see any difference? Or
Yeah, I haven't been sick,
really?
no sickness. Yeah,
Oh, super
there's
cool.
nothing. I mean, I can be around anything, so. Yeah.
And how about your knee? How's that looking?
So my knee, I had both my left and my right. Did wonders on my left. My right one was pretty far gone.
Yeah.
And they told me I was going to need surgery when I was here.
Oh, really? Okay.
So I went ahead and got surgery, and now I'm here.
Okay. Well,
So-
got that. But how's the left one doing?
Great.
Good.
My right shoulder, it healed my bicep tendon, connected my right shoulder.
Oh, yeah,
So-
that was the thing. Yeah, the whole bicep tendon issue, and that's huge. I mean,
Yeah.
fixing that up. So have you been able to get back to the gym at all?
Exactly. Yes.
That's awesome. Oh, cool. Well, it's getting a little busy in here. Nurses run around. So thanks so much for sharing that.
Yeah, absolutely.
People at home, if you're interested in treatment, we do a lot of different things. And there's no limit to treatments. I get asked that a lot. People are like, oh, can I do my knees, intrathecal, IV, all on the same day? And it's no problem. I mean, we just did all those today for you,
Yes.
and you did it last year too.
Yeah.
So that's where we're at with that. We usually, we always do treatment hoping it's one and done. Some people need more, and some people just like to make it like an annual type thing, like keep things going. And you're like, hey,
Absolutely.
that worked. I'm feeling good.
Right.
That's what I do. I do the IV at least, twice a year. I don't recommend doing it that often. Most people just do once a year, but it's maintenance. Get ahead of things before they become a problem. So,
Right.
if you want to learn more, I'm Josh, Dream Body Clinic. You can contact us at www.dreambody.clinic. You can call us toll free at 833-445-9089. And I'm Josh. Happy to help.